Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, July 7th, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto City Councillor and Chair of the Board of Health, Joe Cressy. Mayor Tory.
Thank you, Brad. I'm proud to say that as of now, more than 3.7 million vaccine doses have been administered in the City of Toronto. Over 50% of adults are fully vaccinated. We're making great progress, and that progress will continue thanks to Team Toronto, which has been hard at work getting more people vaccinated every single day. As Chief Pegg will outline, the City continues to have available appointments at City-run clinics, so if you still need to book your first or your second dose, head to toronto.ca/COVID-19 to get an appointment. In fact, as we experience a high number of available appointments, we've made the decision to allow for walk-in appointments at the City's Toronto Congress Centre Vaccination Clinic only. Starting tomorrow, the Toronto Congress Centre will have around 2,500 appointments available per day for walk-in, and these appointments will be available between 12 and 7 p.m. I encourage those who want to take advantage of this to come as early as they can. This service, again, will only be available at the Toronto Congress Centre at the present time. Health professionals have been clear that COVID-19 vaccine is the best way to protect yourself, your loved ones, and your community from COVID-19 and the emerging Delta variant. I encourage people to book their appointments so that we can move forward and put this pandemic behind us. The best single weapon that we have to put this pandemic behind us is getting vaccinated, fully vaccinated, meaning first and second doses. Every single resident in Toronto can therefore play a part, as you have been doing, in making this a reality to get the day closer when the pandemic is behind us. As we continue to move forward in the province's reopening plans, our vaccination rates will also help to ensure us that we can move towards stage 3. We have to keep up the pace that we have so successfully established, and that means filling those appointments at city clinics through toronto.ca, and it means helping a friend or a relative to get an appointment and to get to the vaccination clinic to actually receive the vaccination. We have to close the gap between the more than 50% who have been fully vaccinated and had 2 doses and the high 70s percentages that have had only 1 dose. And that gap is the most important one for us to fill, pushing all numbers up at the same time. I also want to emphasize the confidence that people should have in any of these vaccines and any combination of vaccines between first and second doses. I say that not as a doctor, but as somebody who has myself received a first dose that was AstraZeneca and a second dose that was Moderna. I did this not as a matter of deliberate choice, but as a matter of available supply, but I also did it after obtaining medical advice to the effect that this combination of vaccines, or any combination of vaccines for that matter, was both safe and effective. I urge Torontonians to similarly seek out their own advice in this regard as to the safety of all vaccines, including Moderna, and we have a plentiful supply of that in Ontario, and the safety and effectiveness of any combination of vaccines, including Moderna, Pfizer, and others, for people getting their second dose. A few weeks ago, I provided some updates on the VaxTO campaign, which was launched at the end of May, to help connect Toronto residents with COVID-19 vaccine appointments and information. Since then, the campaign has expanded its outreach further with more multilingual features and the establishment of a call centre to help remove any remaining barriers to vaccination that may still exist. To date, the VaxTO campaign has seen some great engagement success. More than 1 million phone numbers have been called across the city through the campaign's interactive voice broadcast system. 6,519 people have been patched through directly to the provincial booking line as a result of these phone calls. Over 2 million people have been reached through targeted digital ads, and over 16,000 messages have been received via the text line. Through the campaign, the city has also hosted 6 telephone town halls, 5 of which have been ward-focused in individual areas of the city to address unique local concerns and issues. In fact, the next town hall will take place tonight at 6 o'clock for Scarborough-Guildwood area residents with Councillor Paul Ainslie, as well as representatives from Toronto Public Health and local community health organizations and vaccine engagement teams. I encourage all residents to join in, which you can do by texting vaccine to 1-833-750-0888. As we progress in our vaccine efforts, VaxTO will be of immense help in pushing us forward. Starting today, for example, residents can connect to vaccine information in additional languages through one of the 12 translated City of Toronto microsites aligned with the Sprint Strategy 2.0. And while I won't enumerate the list of languages, again, you can find that information on toronto.ca and take advantage of it as the need of yourself or someone else requires. Providing access through these microsites will allow more residents to get the information they need in order to get arrangements made to have a vaccine administered. VaxTO is also expanding its multilingual social and digital advertising efforts through such platforms as WeChat, Reddit, Snapchat, Facebook, and Instagram to help us get to people in every corner of the city, wherever they get their information. And finally, a VaxTO call center is launching today, which will work alongside the vaccine engagement teams that are out in the field to connect with residents living in areas with lower vaccination rates. Call center staff will be calling up to 4,100 residents per week to help them book their first and second dose vaccine appointments. Early focus will be on the northwest part of the city as well as on seniors. As part of the VaxTO and our efforts to focus on areas with low vaccination rates, we'll be hosting a Team Toronto homestretch vaccine push this weekend in the northwest part of the city. Led by the city and Michael Garron Hospital and the University Health Network, Team Vaccine, alongside numerous health agency partners, the aim of the homestretch vaccine push is to encourage vaccine uptake across neighborhoods that currently have the lowest rate of vaccination by breaking down any of the remaining barriers to access. As I mentioned, we have over 77% of residents with their first dose already received and over 50% with their second dose. This is good, but it shows that more work needs to be done, both pushing both of those numbers up, in particular the 50% number to be pushed up and close the gap with the 77% number. We simply have to keep pushing those numbers up and attending to areas where there is lower uptake. Using neighborhood-level data, more than a dozen micro-focused clinics are being planned to take place across 6 priority neighborhoods, including Elms, Old Rexdale, Kingsview Village, the Westway, Mount Dennis, Mount Olive, Silverstone, Jamestown, Weston, Black Creek, Humber, and Englemount, Lawrence. For the Northwest, just to give you an example as to why we're putting on this concentrated effort, the vaccination rates for first dose is 59%. Again, to remind, that's compared with 77% citywide. And for second dose is only 36%, compared with over 50% citywide. So you can see the gap that exists there between the vaccination rates achieved and the rest of the city, and why we're focusing our efforts on that part of the city with this big push this weekend. Almost all of these areas have over 1,000 residents who need either their first dose or their second dose in each of those neighborhoods that I mentioned. These numbers might not seem large, but when you add it up, it paints a picture. And it shows why we need to work on this and why this homestretch campaign that's taking place this weekend, starting this weekend, is so important to our overall success. This will allow us to target specific locations in specific neighborhoods, ones that are easily accessible with high frequency of people and movement. To remove as many barriers to access, these clinics will be conveniently located in and near buildings where people live, and will have flexible afternoon and evening hours for frontline workers or those who have various work shifts. Leading up to it, our community ambassadors and partners will be promoting the various clinics in multiple languages to get the word out to as many people as possible. Additionally, the city's VaxTO campaign will provide support through numerous outreach initiatives, including geographically focused text-based messaging, telephone, voice broadcasts, call center calls, and digital advertising to really get all hands on deck in those areas of our concentration later this week. This one-week micro-targeted vaccine push will help us increase vaccine uptake in a part of the city with currently low vaccination rates. I want to thank our Toronto Public Health Organization, our health partners, and local community groups for making this happen and for helping us target specific communities and neighborhoods through VaxTO. I want to also recognize all the community partners involved with the homestretch vaccine push, and I think it's worthy of mentioning them because this is such an important initiative for us. Rexdale Community Health Center, Unison Health and Community Services, Rexdale Community Hub Partners, Rexdale Women's Center, Rexdale Youth Mentorship, Delta Family Resource, and Albion Neighborhood Services, as well as the Northwest Cluster, made up of 50-plus community agencies, including the Somali Canadian Association, the Ghanaian Canadian Association of Ontario, the Braeburn Neighborhood Place, and Somali Women and Children. I am confident that initiatives like this and partnerships like the ones that I've mentioned will help us get further ahead in our efforts to get more people vaccinated. Before I conclude, I want to make mention of the fact that I've been in touch with the province repeatedly about Step 3 and the importance of receiving urgently the guidelines that we will need in order to have various businesses and individuals prepare for the next phase, because advanced planning is necessary. This clear guidance will help ensure that industries and businesses are prepared and ready to reopen whenever Step 3 arrives. This includes theatre and music venues and other similar venues which are simply unable to do the advanced planning they have to do to put on a performance or offer a concert or provide work to artists who badly need that work without the information that's needed from the province. I know that they're very eager to get this information. This information simply has to come soon if we want to see these people back in business and back to work. These guidelines are past due. I've been talking about this for some time, just as these artists and musicians have been talking about it for a long time as well, because they need this information to make their plans. If you think about it, you can't book an artist to have a concert if you don't know how many tickets you can sell in the venue in question, and this is the kind of guidelines that people are waiting for. With that vital information hopefully in hand very soon, the City will help in any way that it can to implement these changes and to ensure the success of this reopening and seamless transition into the next phase, which we hope will come as soon as it possibly can. On that note, I'd like to invite Chief Pegg to provide an update on our vaccination efforts.
Thank you, Mayor Tory, and good afternoon. Each and every day, we are administering thousands of doses of COVID-19 vaccine across Toronto. In fact, yesterday alone, more than 44,000 doses of vaccine were administered in Toronto across the network of city-operated clinics, Team Toronto partner clinics, pharmacies, and by primary care physicians. On a daily basis, approximately 10% of the doses administered are first doses of vaccine, with the remaining 90% being second doses. This is exciting, as every dose of vaccine that is administered means that another person is protecting themselves and those around them from COVID-19. Our 9 city-operated mass vaccine clinics continue to operate 7 days per week. We are fortunate to be in the position where we now have sufficient vaccine allocation to permit maximum capacity operations in every clinic on a daily basis. Each day, 17,820 people are able to receive their COVID-19 vaccine in city-operated clinics, in addition to all the doses being administered by our Team Toronto partners, pharmacies, and primary care physicians across the city. More than 205,000 people have already booked their upcoming vaccine appointments in city-operated clinics. I'm pleased to report that there are still lots of appointments available, including availability for this week, for those who have yet to receive their first dose of COVID-19 vaccine and for those who require their second dose of vaccine. If you received your first dose of either Pfizer or Moderna mRNA vaccine at least 28 days ago, or if you received your first dose of AstraZeneca at least 8 weeks ago, you are eligible to receive your second dose of vaccine now, and I encourage you to do so. For the remainder of this week, there are approximately 26,000 vaccine appointments available in city-operated clinics, 49,000 for the week of July 12th, and 90,000 for the week of July 19th. As more and more people are completing their COVID-19 vaccinations, and now that we have an excellent supply of vaccine to administer, we are taking the opportunity to further evolve our clinic operating model to make it even easier for people to be vaccinated. Accordingly, as Mayor Tory announced, we will be launching a walk-in vaccine program in our Toronto Congress Centre location beginning tomorrow. The walk-in program is in addition to the scheduled appointment system that is already in place. And I continue to encourage everyone who would prefer to have a confirmed date and time for their vaccine appointment to book via the provincial booking system. However, starting tomorrow at our Toronto Congress Centre location only, we will accept walk-in vaccine clients who do not have a pre-scheduled appointment between the hours of 12 noon and 7 p.m. daily. There will be a clearly defined walk-in client line with clinic staff there to greet and assist those who arrive for walk-in services. Our staff will register and vaccinate walk-in clients when they arrive on a first-come, first-served basis. There will be no change nor any impact to those clients who have a pre-scheduled appointment. They will continue to receive their vaccine on their scheduled date and time. Our clinic management team will monitor vaccine availability throughout the day with the goal of administering every available dose of vaccine each day. We will monitor and evaluate the effectiveness of this program over the next several days and will consider expanding walk-in services to include other city-operated clinics moving forward, in accordance with individual clinic capacity and appointment availability. Based on current appointment availability, from Thursday through Sunday this week, there are more than 2,000 walk-in appointments available each of these days at the Toronto Congress Centre. We will provide the number of walk-in appointments available each day to Vaccine Hunters Canada, such that they can share this information with their social media followers. To be clear, the walk-in program will only be available in the Toronto Congress Centre clinic location until further notice, and will be available from 12 noon through 7 p.m. daily. For information on the eligibility to receive vaccine and to book your appointment in a city-operated clinic, please visit toronto.ca/COVID-19. If you prefer to either book or reschedule your appointment by phone, you can do so by calling the Provincial call centre at 1-833-943-3900. Please ensure that you cancel your appointment via the Provincial booking system or the Provincial call centre in the event that you will not be attending your scheduled appointment. I continue to encourage everyone to access our toronto.ca/COVID-19 website for the most current information on vaccines and COVID-19 response in Toronto. Thank you. I will now invite Dr. Davila to bring her remarks for this afternoon.
Thank you, Chief Pegg, and good afternoon. Today, there are 27 new cases of COVID-19 in Toronto. 68 people are in hospital. 24 people are in the ICU. And I'm sorry to say there is one new death to report as a result of COVID-19. In my view, at this point in the pandemic, while we are less at the mercy of the COVID-19 virus, we aren't quite in total control of it either. What we have is the upper hand. The job now is to keep it. Doing that means closing the vaccination gap and individually remembering that with the Delta variant circulating, first dose is not full protection from COVID-19. This requires full vaccination, which takes 2 doses and then 2 weeks to let your body build up best protection. In terms of how we're doing on vaccination, the news is mostly very good. The group with the highest level of first dose vaccination is young people ages 18 to 24. They are almost 90% vaccinated with their first dose. They are approaching the 50% mark for second doses. This is amazing because in many other places, public health units are struggling to get young people to be vaccinated. So I particularly want to acknowledge and thank young people because they're stepping up as real leaders in all of this. And it's a terrific thing to see and a terrific example to everyone of all ages. You should be very proud of yourselves. I know that I'm proud of you. Still, there are a number of age groups where there's a big opportunity to close the vaccination gap. I'm a little concerned, for example, about people from age 35 through age 49 who are still in the low 70s in terms of the percentage of first doses delivered. Above and beyond age, overall, as you heard from the mayor, we have about 25% of the city that still hasn't received a first dose, and about 50% of people left to get a second dose and be fully vaccinated. Right now, the single biggest risk to your health is not being vaccinated. Both mRNA vaccines offer you equally strong protection and a safe pathway forward into life in reopening. We're at a point in the pandemic where Toronto is in two places at once. The progress in vaccination we've made is making a difference. We're healthier, we're safer, and we're sustaining the momentum toward more and more reopening. Still, there are a lot of people at risk because they haven't been vaccinated. To cement our progress and close the vaccination gap, we need people willing to roll up their sleeves to get fully vaccinated. On July the 1st, I went to the Metro Toronto Convention Centre because I was eligible to complete my vaccination. My second dose was the Moderna vaccine. During my appointment, a voice boomed out, top of the lungs, "I am fully vaccinated." And the people nearby spontaneously clapped and cheered. That voice belonged to my youngest, who was also eligible for a second dose and had come along with me to get it done. But it reminded me what a thrill it is for people to get vaccinated and to have the peace of mind and the sense of control that being vaccinated brings. So I encourage anyone who still has the opportunity to get fully vaccinated to do it. It's one of those rare moments in life that you really have to try for yourself to know how great it feels. I'll now hand it over to Councillor Cressy to deliver his remarks.
Well, thank you, Mayor Tory, Dr. Davila, and Chief Pegg. In Toronto, we're entering the next stage in our efforts to get first and second doses to everyone, everywhere. And so today I'd like to tell you a little bit more about our upcoming home stretch vaccine push. Our data shows that there are certain areas in our city with lower vaccine rates. And to reach them, to break down every barrier and build every bridge to vaccines, we've joined with our hospital partners and on-the-ground community agencies to roll out a one-week vaccine push in 6 targeted neighborhoods in the Northwest, starting on Saturday, July the 10th. It's a comprehensive all-hands-on-deck approach, and one that we believe will set the stage for targeted neighborhood campaigns to come. So let me describe the model in 4 parts. First, we're using neighborhood-level data to pinpoint exact locations for hyper-local pop-up clinics. And so we're setting up clinics in the common rooms and parking lots of specific buildings where we know vaccine rates are low. Second, we're setting up the clinics to make them as accessible as possible. So for example, we're hosting multiple clinics in the same location and over different hours, including in the evening, in order to reach everyone, including and especially frontline workers. Third, community outreach, and outreach. In the days leading up to these clinics, on-the-ground community agencies and neighborhood ambassadors are going door to door and reaching out in multiple languages to promote the clinics, to answer questions, and to identify any barriers people may have. This is the equivalent of boots on the ground, but in this case, it's trusted local community leaders talking directly to their neighbors. And fourth, and finally, our VaxTO campaign will be reaching out directly to residents in these buildings and neighborhoods leading up to the clinics. As the mayor mentioned, our VaxTO call center launches today to call residents directly. This is an old-fashioned phone bank, employed to help end a 21st century pandemic. We're also rolling out, as part of VaxTO, targeted multilingual digital ads in 12 languages, which are connected to multilingual microsites, and these are rolling out starting today online, again, targeted into these neighborhoods where people live. And so, in many ways, this homestretch vaccine push, well, it's similar to the polio vaccine campaigns of the 1950s. Those campaigns went building by building to get people vaccinated. Same here. This approach is also similar to an election, something that I've been a part of. Only in this case, instead of multiple polling stations, we have multiple clinics. And instead of door knocking and phone banking to ask for your vote, we're canvassing and calling residents to answer their questions and to help them access a clinic. And so this week-long homestretch vaccine push, it is a team effort. It's Team Toronto. Our hospital partners, Toronto Public Health in the city, community agencies, neighborhood ambassadors, everyone is involved. And so as we're entering a moment in this vaccination campaign, it's in many ways kind of like the last mile of a race. In many ways, the hardest mile. It will take all of us, all Team Toronto partners and every resident in our city, to get to the finish line. So let's just keep pushing, let's keep working, and let's do everything we can to get Toronto vaccinated. With that, I'll turn it over to Brad Ross, and we can open it up for questions.
Thank you very much, Councillor. We will go now to questions. Just a reminder to please unmute yourself, and we'll go first to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Yeah, good afternoon, everybody. First question is, guessing for either the Mayor or Dr. Davila. As you're aware, Ontario remains one of the few places in North America still under strict COVID-19 rules. But even if the province were to lift all the restrictions tomorrow, Toronto still has 4 bylaws in effect mandating social distancing, mask wearing, indoor dining, all of which were extended last month until the beginning of October. I believe the council meeting at the end of September. With cases falling in the city's near daily pronouncements about hitting vaccination milestones, has there been any appetite to revisit this, perhaps look at ending things a little sooner, or at least go in lockstep with whatever the province decides?
We're taking our lead very much from what the province does, and I will say that I'm part of a group of mayors. I chair these meetings each week of the mayors and chairs from this entire region who have agreed that while we would love to see numbers and circumstances that could cause the province to look at opening up some of these indoor activities sooner, that we understand there's a plan in place, we understand there's a reason for it, which has to do not just with levels of vaccination and so on, but also with the effective period. In other words, after you get vaccinated, it's not fully effective for a couple of weeks after that. So having said all that, we are monitoring all these things all the time. I am in discussions with everybody in the provincial government up to and including the Premier on basically a daily basis about these things. And I think all of us, him, me, everybody else, want to see as many things open as soon as possible, but safely done. And so in that sense, the same is true of our bylaws. It's not possible for us in the same fashion to review those every day with a view to just deciding they could be lifted without the City Council having a meeting, but that we're looking at these things all the time. And if it was necessary or appropriate for us to take some steps, including even calling a special council meeting in order to do something that seemed urgent in that regard, of course we would do it. But I think the important thing for the moment that we've been really focused on is getting people vaccinated so that we can get to that stage where it isn't, say, a gap between 50% of people that have had the full vaccination and close to 80% that have had the first dose, but rather we get to the point where, you know, we have high numbers for both the first and second doses, and that's the kind of threshold when we can feel entirely confident about opening up even more than stage 3 will permit.
Thanks, Brad. I think the only thing I would add to that, which the Mayor has already covered, is that, of course, we do absolutely assess the circumstances regularly and are constantly looking and assessing the need for measures like the bylaws that currently exist. Further to that, over and above the vaccination that the Mayor just spoke of, evidence from the world over suggests that a slow, cautious approach with respect to reopening is the best in order to sustain the progress that has been made. And fundamentally, of course, it has to be driven by the data. That has been our approach throughout the pandemic. It has served us well, and I think it's exactly the way we need to continue in order to continue the good progress that we're seeing thus far.
Okay, thank you. My second question, the decision to commence walk-ins at the Toronto Congress Centre, is this a pilot project or are there plans to roll this out to other city-run clinics eventually?
Chief?
Hi, good afternoon, Brian. It is a pilot program of sorts, and what I mean by that is we're opening in the Toronto Congress Centre beginning tomorrow. We'll monitor that very carefully over the next number of days. I have every confidence that it will be a successful program. We have the processes in place to monitor appointment availability and, of course, vaccine availability on a daily basis. So we're connecting those things, making the walk-ins available initially at Toronto Congress Centre, and certainly prepared to look at expanding that into other clinics. We just need to be sensitive and cognizant of the fact that we have quite a diverse clinic model across the city. In the 9 city-operated clinics, we have clinics of different sizes, different capacities. So those things need to be factored in. We'll do that, and certainly those are conversations that early next week our immunization task force will be looking at the outcome and the successes of what's transpired over the end of this week. And if there's an opportunity to expand it, we absolutely will.
All right, thank you. We'll go next to Lorenda Redicott from CBC News. Lorenda?
Hi there, everyone. Following up on that question about the potential for stage or step 3 reopening earlier, we heard from the mayor of Brampton earlier, and he said that he'd be comfortable with it potentially happening more than a week ahead of schedule. Mayor Tory and Dr. Davila, what are your thoughts on that? Could it be earlier than it is currently scheduled for?
Well, I will start, and again, I'm sure Dr. Villa will add as she wishes. When we had the meeting of all the mayors and chairs for this region, we said in a statement we issued this past Monday that we would certainly be receptive to any possibility that the numbers and other prevailing circumstances presented for the medical officer of health for the province to advise the government that it was possible for us to open earlier. And that we were very receptive to that, especially as regards, say, even some of the indoor activities like indoor swimming pools, some indoor recreation, that kind of thing. But we've also made it clear, I think, repeatedly, that first of all, we're trying to maintain unity as a group on that because we believe that that kind of opening and closing should be regional, but also make sure that we leave the province with the latitude to make that decision based on the numbers and based on all of the prevailing circumstances. And so, again, I repeat, I, as the Mayor of Toronto, together I think with all the other mayors and chairs, would like to see as many things open as soon as possible. But we want to see it done safely and cautiously, and that's what we all agreed that we would, maintain that position, but have the province know. And I've had communication with the Premier on this, that if circumstances permitted an open earlier situation, then of course we would be content with that if the numbers permitted that.
So, Lorenda, I think the only thing I can add further, again, to what the mayor has said is that he's spoken about the need for a safe and a cautious approach. That certainly is in keeping with the evidence that we see from around the world, the experiences of jurisdictions that are a little bit ahead of us in their pandemic journey, as it were. They note that a cautious approach, a slow, careful approach, really is what protects health best. I think the other point that's worth mentioning here is that with each step, it does take some time before you actually have the opportunity to see what the increased movement of people does by way of increasing transmission. Hence another reason to be cautious in the approach so that we can be successful and maintain the progress that we've made to date. That, in addition to ensuring that vaccination is provided to the greatest extent possible, getting those coverage rates up as high as possible, along with a cautious approach that's driven by evidence and data. I think these are the elements for the recipe to success in terms of getting out of the pandemic safely.
Thanks for that. This one would be for Dr. Davila. We are hearing that there's a possible COVID-19 outbreak at the Park Armory. Can you confirm this and give any more details in terms of cases? And what are you doing when it comes to contact tracing, given that with this being the military, I imagine there would have been a lot of people together.
Lorena, could you just repeat the first bit of your question there, please? It was just difficult to hear.
Sure, no problem. We are hearing that there's possibly a COVID-19 outbreak at the Moss Park Armory. Do you want me to repeat the rest?
I didn't hear. Thank you, Lorinda. So I'm not familiar with that particular circumstance, so I'm afraid I can't comment on that. Happy to follow up offline, though.
Okay, thank you, Dr. Davila. Thank you, Lorinda. We'll go next to Mark Douglas from 680 News. Mark?
Thanks, Brad. Question for Dr. Davila first. The Ontario government today was reporting 0 new deaths. You are reporting 1 new COVID death for Toronto, and I know there's always a sort of a statistical difference between the two reporting systems, but either way, are such low fatality numbers both kind of a cause for celebration, but also possibly a trap for a false sense of security? If people hear that nobody's dying of COVID today, maybe it's not such a bad problem, and maybe they don't need to get vaccinated. Is that a concern?
Well, I think that for people to get complacent around COVID is certainly a concern. So I would encourage people to stay vigilant and to recognize that, you know, this virus is still wreaking havoc in many, many parts around the world. And to the extent that it continues to transmit around the world, it allows for that opportunity for new variants of concern to emerge that are potentially either more transmissible or may be able to elude vaccine or may cause more significant illness. So I would encourage people to stay vigilant, to recognize that any success that we've had to date has been due in large part to our vaccination efforts and their participation in vaccination campaigns. So as I mentioned in my remarks, I would strongly recommend to people who have not yet taken the opportunity to have the protective benefit of vaccines provided to them to go out, get that vaccine, and I can promise them that it will feel, it is a great feeling to have that sense of control and that sense of protection that vaccine provides, and it's a well-founded sense of protection.
Thank you. And Dr. Davila, a follow-up question then for yourself. Again, has the Lambda variant been detected in Toronto? And how concerned should people of the city be about that particular variant?
Well, it's interesting, you know, we were just talking about variants and the concern that they present to us as a global community. I think that's why when you hear about vaccination efforts, yes, of course, first and foremost, we're concerned around vaccination efforts here in our own city. But I think as members of what is truly a global community, we do need to be concerned about vaccination the world over, because we are so mobile. There is so much movement from one country to the next that we know that if we're not protected well, you know, as far as the country might be from here, from our home, we know that none of us is protected if we aren't all protected. So I have not heard specific news of Lambda variant here. That being said, given the nature of the way people move around the world, I won't be surprised that we're in a very global cosmopolitan city here in Toronto, one of our many, many benefits. But again, it just speaks to the need for vaccination. And once again, I would urge Torontonians who have not yet taken part in vaccination to do so. It is truly the best way to protect yourself, the best way to protect our city, and the best way to get us to the other side of this pandemic.
Right, thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Jen, go ahead, please.
Good afternoon, everyone. My first question was for Chief Pegg. I wondered about the future of the mega sites. I know obviously you're talking about walk-ins at the Congress Center and monitoring whether there's uptake on those appointments. But just given the city's more targeted strategy in the Northwest and hopefully other parts of the city, whether those large sites will be you believe still in operation through the fall, and if not, if there's some better use for those vaccines and those bodies, resources you have to perhaps help with the more targeted strategy.
Thanks, Jennifer, and good afternoon. So those are conversations and analysis that are ongoing pretty much every day and have been throughout the course of operations. So our immunization task force is looking live time on a day-to-day basis at what is happening across the entire network of our 9 city-operated clinics, and then, of course, looking forward into projections against vaccine availability, of course, the information coming directly from Dr. DeVille and the Toronto Public Health team with respect to all sorts of medical data, that all of that gets overlaid and, of course, gets analyzed and rolled up, if you will, and brought forward to our immunization task force. So the go-forward look at this point in time, we don't have any plans at this point to adjust or alter our service delivery model in the city-operated clinics. But having said that, as we announced, as Mayor Tory announced, and we spoke about just at this press conference, we are again evolving and enhancing our clinic operating model to now include the launch of walk-in service. We'll watch that very closely and evaluate the effectiveness of that. And if, of course, that proves to be successful, which I have every confidence that it will, that may give us an opportunity to expand that into the other clinics. On a go-forward basis from there, ultimately the decision to adjust or alter and at some point in time to shut down, to begin the scale down and shutdown of clinics, is actually a medical decision. So those are decisions that would come under the authority of Dr. Davila and with the direct advice and guidance of the Toronto Public Health team from a medical oversight perspective. Our teams are in place. We have already built the demobilization plans for the eventuality of clinic shutdowns. So as far as the precursor work and the proactive work, if you will, to make sure that we're ready to do that when the time comes, that work's already done and is certainly continuing to be evolved and updated. The actual decision as to when mass immunization clinics will no longer be required or when we should transition to a different model will come at the advice of Dr. Davila and her team.
Councillor Cressy?
And Jennifer, just one thing to add to that. The Chief mentioned the assessment that will take place going forward. It's just worth on this point reiterating something the Chief mentioned in his remarks, which is that there are currently, as of today, 205,000 appointments already booked in the coming months at city MICs. And so while the discussion and considerations for the future will be made, as the Chief mentioned, it's worth remembering more than 200,000 appointments are already booked, and that's a huge sign and statement of Torontonians continuing to step up for vaccines.
Thanks. And just a second question. I was curious what your first dose was. I can't remember. I think you told us back when. And I'm asking because I had a note from a senior named Esther, and I think she maybe falls into a category of people beyond herself, where she received Pfizer back in April, and she calls herself a Pfizer holdout. She said despite the evidence that Moderna is safe and effective for her to get her second dose, she's wanting to wait until the city can offer her Pfizer. And so, in spite of what we know about Moderna being a perfectly good choice for people, whether there's any plan to help people get a matching vaccine just to get those shots in arms.
Oh, I guess you're Miss Press.
Dr. Davila?
For me, yes. So thanks, Jennifer. So I guess the way I would characterize myself is that I was not a Pfizer holdout. I did receive Pfizer as my first dose, and as I mentioned today, I got Moderna as a second dose. This is in keeping with the available science that tells us that these mRNA vaccines are very effective in terms of providing protection against COVID-19. And on top of that, as per the National Advisory Committee on Immunization, the guidance group, the group that gives us guidance here in Canada in respect of vaccine use, they tell us that these are effectively interchangeable. Hence, I felt quite comfortable taking Moderna as a second dose, and I'm happy to say that I've gotten that second dose of vaccine and am well on my way to getting that full protection provided by the vaccine. So I would say this. I recognize that there are people who are interested in receiving a particular kind of vaccine. You know, the science suggests that what you need to do is get full protection. And I would encourage people still to get that vaccine dose as soon as they can, to get that first dose, and then in the appropriate time, get that second dose as soon as possible. In order to experience the benefit of best protection that's provided by 2 doses. And, to my mind, I didn't see any issue in keeping with the best available science. There are studies going on around the world around using different vaccines. And again, the results are all quite positive, showing again that the protective benefit of vaccines is very high and something that people can feel quite confident about.
Thank you. We'll go next to Dave Woodard from Global News Radio 640. Dave, go ahead.
Good afternoon. This question is for Dr. Davila. The Ontario Chief Medical Officer of Health said yesterday that out of those who are in hospital with COVID, only about 1% of them were fully vaccinated. So with 50% of Torontonians, or with more than 50% of Torontonians fully vaccinated, could the city start looking at loosening restrictions for those who have had 2 doses? As an example, doing away with mask mandates for those who are fully vaccinated.
So, an interesting question, and certainly I think the remarks made by Dr. Moore, Chief Medical Officer of Health, talk again to the importance of the protective benefit of vaccines. I think that's the main point that I would like to see people take away from that these vaccines do provide protection, important protection against COVID-19, and I would encourage people who have yet to be vaccinated to go and do so in order to get that benefit, that protective benefit for themselves and for those around them. With respect to what restrictions are in place and what activities may or may not happen, as the Mayor mentioned earlier in an answer to a previous question, much of that rests in the hands of our provincial counterparts. They lay out the legislation and regulations that stipulate what may happen and what may open and what may not. There are certainly some bylaws that are in place here in the city that are regularly assessed, and I would say this, that we are adjusting our response as we have throughout the entire pandemic in keeping with the best available data and the best available evidence. And right now, that suggests a cautious and slow approach, while at the same time really pushing out vaccination so that people can get the protective benefit of vaccines while we do what, while we, get more vaccinated. We maintain a very cautious and slow approach with respect to reopening. These things taken together are the kinds of things that will get us to the other side of this pandemic in as safe a fashion as is possible.
Okay, thank you, Dr. Davila. My next question for you is, there was another data dump from Toronto Public Health that affected the provincial numbers significantly. It seems that Toronto is the only public health unit that regularly have these data issues. Can you explain what seems to be the problem with the reporting that these issues seemingly come up every few weeks?
So it's not entirely clear to me that we are the only jurisdiction that is having, that does data cleanup. I would like to think that my colleagues around the province are as committed to ensuring high levels of quality when it comes to data. I would say that we are the largest jurisdiction in the province and we experience the largest number of cases, and therefore we have the largest data quality work or body of work that needs to be undertaken. So I think it is very important that we maintain high levels of quality when it comes to data and reporting. It helps us understand what has happened in the course of the pandemic, which is fundamental in order for us to plan for future outbreaks, future pandemics, future infectious disease circumstances. So it is about data quality and making sure that we are providing the best available data, and that does require cleanups sometimes after the fact. And these are, I would say, fairly typical activities that are taken in the course of public health practice. I'm sure they're happening all over the province. It's just that we happen to have it at a larger scale given our size.
Thank you, Dr. Davila. And our final question is to Natalie Johnson from CTV News. Go ahead, Natalie.
Hi, everyone. Obviously, the northwest corner of the city is focused right now on your vaccination push. Do you have any insight as to why these particular neighborhoods in that part of Toronto are under-vaccinated compared to others?
So Natalie, why don't I start, and we'll see whether any of my colleagues have anything further to add. I think there are a number of reasons that are involved when it comes to a certain reluctance or not taking up vaccine. Let's call it that. That's probably more appropriate. Access is one. We heard from a number of people that getting time in the day when you're busy with jobs that are at odd hours. It's not always easy to get to vaccine clinics. So certainly having access, having the vaccine clinic available at different hours, close to home, that don't require a lot of travel, that's one thing that is certainly an issue. I think that there has also been some historical mistrust of healthcare, and I think we have to be very honest and candid about that. That is certainly something that we've heard from our community partners out there, that the experiences with healthcare have not always been positive for many members of this community. Hence, there is a little bit of a hesitancy, if you will, in terms of trusting information that's coming forth from healthcare providers just because of historical issues in the past. These are the kinds of things that are really important bits of information that we get when we engage with community leaders who are part of the community, who are steeped in that community and have a deep trust. And that's why we're relying on those community partners to help deliver the message that this is in fact a protective service that's being provided. It is a therapeutic and valuable protective intervention that is good for health at an individual level, but also good for community health as well. I think the Mayor wanted to add something.
Yeah, well, I would just say we discover all kinds of issues that perhaps are unintentional barriers that stand in the way of some people in some of those neighborhoods getting vaccinated. There's language. There can be language. There's information where there may be not as much that came to the attention of people. There is access, which relates both to geography and also to time. And we've tried to accommodate each of these things. There's a mobility issue, and then there's trust. And so every one of those things we've tried to deal with in terms of the effort that we're going to be making throughout, and also we'll be making this weekend. Language, by having more information in more languages. Trust, by having people who are trusted locally and known to the local residents that are the ones that are promoting and attending at the vaccine clinics. Location, geography, to make it easier for people right in some of their buildings or right in the adjacent buildings to where they live. And this is all meant to take these barriers that sometimes are unintentionally in place and take those down so that people will find it easy to get to vaccines. When you look at the Scotiabank Arena example, that was in a place people knew and loved, but more importantly, in a way, was the fact it was surrounded by all kinds of high-rise condo and apartment buildings that had a level of under-vaccination among a certain population. And it worked brilliantly, and then if you look at who came, among the thousands of people who did, it was exactly who was intended to come, which was people who lived around there, who were people who could walk there, and who got some excitement about being in a place that they love. And so we're trying to replicate the same thing, a place that people know and are comfortable in, make it easy for them to get there, and make sure that they are greeted when they get there by people they trust and that they know in order to make sure they're comfortable in the process of getting vaccinated, in the language, for example, of their first choosing.
Thank you. Is it fair to say that you're launching this homestretch initiative because you feel like first dose vaccinations are hitting a plateau at this point? Is that a fair assessment?
Well, I think you've heard from the numbers that we are certainly seeing larger volumes on second doses, but we are still seeing a fair number of first doses. I would also say this, that we know that as you move into the higher proportions, as we have more and more people vaccinated, and we're getting to, the last, 25% or so of those left in the city to get their first dose. It does require different methods than that which has been available. So, and we actually have the supply to allow us to do that. Now supply isn't a challenge where it was much earlier in the vaccination campaign. So with a more ready supply available, we can continue to run mass immunization clinics at a significant level and have partner vaccination clinics as we have had for the last several weeks, and still have some supply to add other avenues and channels to reduce all the barriers, exactly as the Mayor had said, to those who have yet to get vaccinated. So I think this is just another method that is now available to us, particularly given that we have supply, to allow us to really drive up coverage rates, which we know will be fundamental towards a safe reopening and getting us to the other side of this pandemic.
Mayor Tory?
It's something where we are adapting all of our methods, as you've heard today, to take account of what is really, in the end, human nature. You know, when you're dealing with a body of 3 million people that have to do anything, I mean, if they're having to switch over a service or having to, you know, change out smoke alarms in their homes, there's going to be early adopters who do it just because they're eager. There's going to be people who do it in the ordinary course, just in the sort of a timetable you might expect. And then there are those who take longer, either because they have reasons of trust or because they don't get around to it or because they weren't aware of it. And it seems hard to believe that people might not be aware of the opportunities after all this time and all the attention that's been paid. But there are people out there who have many other things on their mind. So we're trying to adapt our methods to not only have the clinics that we've had going for some time, which still continue to vaccinate thousands of people, but also have these very localized efforts that address some of these things. And so I look at how much we've done and how far we've come, which is incredible. And, you know, it's now to the stage where Canada is at the top of the world in terms of first dose, but we know here that that's a good step, but it's not enough. And we now need to push that second dose number up to that kind of world-leading kind of level. And we think here in the City of Toronto we're adopting the combination of methods through the clinics and through the very localized efforts that Councillor Cressy and others are leading starting this weekend, and we've been doing it throughout to do just that.
Councillor Cressy, you want to add something?
Well, the mayor spoke to how the commitment here is to reach everyone, everywhere, where you live, where you work, the language you speak, and in doing so to break down every barrier. I would just note that as part of this home stretch push, it's also a transition to a highly, highly targeted approach, where we are literally, with our hospital partners, using neighborhood-level data to identify specific buildings, specific blocks, where vaccination rates are lower. And so in addition to the mass immunization clinics and the hospital clinics and the mobile clinics, this is a highly targeted, locally targeted approach to bring vaccines directly to where people are, where rates are lower. And that's a data-driven approach, and I think it's an important approach that's being implemented here.
All right, thank you very much, everybody, for joining us. That concludes today's briefing. Please take care and stay well.